please invite Dr. Vanshika Khanna for her paper presentation, please. Yeah, welcome. Kindly introduce yourself first.
Time for the paper. Duration is 5 minutes, okay? 5 minutes.
Will they have the time? The IT team, would you have the timer buzz at 5 minutes? Okay, good. Yeah, so please introduce yourself.
Versus lignocaine. As we know, pterygium is an elastotic degeneration of the subconjunctival tissue that affects the exposed bulbar conjunctiva nasally more than temporally, causing visual impairment when it encroaches the pupillary area. The gold standard for its treatment is surgical excision with conjunctival autograft. Though the long-term patient satisfaction following CAG is high, in the immediate post-operative period, the patient may experience considerable pain and discomfort at the surgical site once the anesthesia has worn off. Ocular pain is one of the most common post-operative complaints in these patients, causing discomfort. The cause behind this pain is the persistent inflammation post-surgery, which, if left untreated, may lead to recurrence. Thus, prompt control of ocular surface inflammation intra and post-operatively in pterygium surgery is an important determinant for reducing patient discomfort and subsequent recurrence. The aim of my study is to compare the effect of subconjunctival dexamethasone and lignocaine on conjunctival autograft harvesting in patients undergoing pterygium excision with CAG in their immediate post-operative period. This is a prospective interventional comparative study including 52 eyes of 52 patients who underwent the surgery for the same. All patients having primary nasal pterygium with grade 1 or 2 were included in the study. The exclusion criteria included patients who required general anesthesia, patients with recurrent pterygium, temporal pterygium, or a double-headed kissing pterygium. Patients having any other ocular pathology, ocular surgical history, or any bleeding disorder or systemic comorbidities. The patients were divided into two groups. Group A consisted of patients in whom CAG was harvested using 0.5 ml of 0.4% dexamethasone. Group B consisted of patients in whom 2% lignocaine was used for the same. All surgeries were performed by a single surgeon. After patch removal at 12 hours, patients were started on topical loteprednol, topical moxifloxacin, and a lubricant. The symptoms of pain, watering, and foreign body sensation were taken as a subjective measure of inflammation and were recorded 12 and 24 hours post-surgery. The objective signs of inflammation like conjunctival inflammation and lid edema were also recorded 12 and 24 hours post-surgery. The subjective signs were graded using the Likert scale that was included in the questionnaire, and the objective signs were graded on slit lamp examination. Observation and results. The mean age of Group A and Group B patients was about 47 and 46 years respectively. The male is to female ratio was 1.6 and 1.1:1 in the two groups. The mean surgical time in both the groups was about 243 seconds and 258 seconds respectively. No statistical difference was noted between the two groups with respect to age, gender, grade of pterygium, and surgical time required. This has been shown in Table 1. Post-operative pain, foreign body sensation, and watering was statistically significantly lower in Group A than in Group B at both 12 and 24 hours. Conjunctival inflammation was also statistically significantly lower in Group A at both the hours post-surgery. Lid edema, however, failed to show any significant difference with respect to severity in both the groups. One patient in Group A and two patients in Group B had graft displacement, which was repositioned under aseptic conditions. However, no statistical difference between the two groups was noted in this regard. This is the second table that shows the comparison of characteristics in the subjective inflammation, and table 3 shows the comparison among the objective signs.
1 minute.
This
more.
is a yes, ma'am.
Just a minute more.
Oh, yeah. This is a picture showing pre- and post-operative images of pterygium excision using dexamethasone. And the second is using lignocaine. As we can see in the post-operative image, the conjunctival congestion and inflammation is more. Discussion. The main clinical considerations for patient satisfaction in the early post-operative period in those undergoing pterygium surgery are cosmesis and patient discomfort due to surgical trauma. The long-term satisfaction depends on recurrence of pterygium. Ocular pain, discomfort, and redness are the most common post-operative complaints of patients as a result of surgical trauma and ocular surface inflammation. Corticosteroids are well-known anti-inflammatory agents that can be used both topically and subconjunctivally to decrease perioperative inflammation. Take-home message. This study recommends the use of subconjunctival dexamethasone for graft harvesting in pterygium excision surgery with CAG due to its benefits in reducing ocular discomfort, inflammation, foreign body sensation, and ocular pain in the immediate post-op period, thereby enhancing post-operative ocular cosmesis and patient satisfaction. Thank you.
Yeah. Just a question for Dr. Vanshika.
Yes, ma'am.
Were your surgeries done under peribulbar block or under topical anesthesia?
No, ma'am, peribulbar block.
Peribulbar block. Okay. So there are a lot of other factors too which determine the
Exactly, ma'am.
outcomes and symptomatology
Depends.
after pterygium surgery. And did you attach the graft with glue or the
No,
sutures
we
were
left
used?
it with the blood clot.
Okay, so that is why the graft displacement.
Took place. There were 3 patients with graft displacement, and
Okay.
sutures were not taken.
So actually with such a small cohort, I believe that even 3 patients is a significant number.
It was high.
So I think, according to me, you should consider using either a glue or probably
Sutures.
just 2 sutures to attach 80 vehicle. I don't know what means.
Anyhow, you are giving post-operative steroids now. What is the role of intraoperative steroid use?
Intraoperatively, we were giving steroids. That is what we used, 0.5 ml dexamethasone to raise the bleb.
No, anyhow, we are starting post-operatively steroids. What is
Yes.
the rationale behind using intraoperative?
To further enhance the post-op inflammation, because the compliance with post-operative steroids is not in our hands. So we were just doing a study because earlier we were using normal saline for
For these
graft.
patients, you didn't use post-operative steroids?
No, we use post-operative steroids without bias in both the groups.
And what about bandage contact lens? Did you place?
No, ma'am, we did not use. It
So
was a
how-
tertiary center and BCL was not affordable to
That
the
is the
patients.
main factor which prevents
Post-operative.
post-operative pain and redness, because if you have a bandage contact lens in place, the symptomatology, the symptoms are automatically
Less.
drastically reduced rather.
But that was not kid-friendly
Okay,
for the patient.
thank you so much.
Thank you.